Hello and welcome to the newest edition of School Talk. My name is Wyatt Williams, and here with me, our very special guest of the day, the school nurse for Jeffersonville High School, Miss Nola Garrison. How are you doing today?
I'm doing well, thank you.
Absolutely. So as we get started here, we're in a pandemic. This is a crazy world that we live in, and I'm sure as a school nurse it would be even crazier. But what does the daily life now for you look like just compared to before COVID? How have those changes, or what are those changes that you've seen so far?
I think mostly the changes have been just how we intercept students that are ill. And because the state did a nice job of setting down priorities and kind of mandates and directions for us to, our administration was able to actually separate well kids from sick kids. So we actually have 2 clinics at Jeff High now. And so we send kids with any kind of symptoms to our sick clinic, and then any students that have like first aid, medicine, daily meds, or chronic illnesses, they'll come to the well clinic. And so we actually have our health assistant is manning the sick clinic, and then I'm doing the well clinic with the meds and the chronic illnesses. So that's a big difference, just basically having 2 spaces to not have kids that are ill affecting those that are not.
How do your daily protocols differentiate with your normal day versus, now with, say, a kid that just has your routine illness versus, with the pandemic now? How is that differentiated on how you guys handle that?
Well, there's not a whole lot about how we handle it. The difference now more is that those kids with chronic illnesses have chosen to stay home. So those are my school online kids. And we have a large population of children that had chronic illnesses have chosen not to come to school, which has kind of made my job a little easier in the sense that I'm not having those kids, I'm not seeing those kids. I'm not as responsible for them, but all of our special needs kids have always been in the building. So a lot of those kids are still in the building that we still have, but then some of those have had maybe private nurses that came to school with them, then they're choosing not to come to school. It depends on the severity of their illnesses. So it's somewhat made it easier in the sense that we don't have as many students, but the students that are ill, we want to make sure, that have chronic illnesses, we want to make sure they're not exposed to kids that are ill.
So can you explain the process of what happens when someone does test positive for COVID or they are exposed? How do you, as the school nurse, how do you proceed with that?
There again, I think our administration has been awesome as far as setting up protocol, and they take the CDC guidelines and the state guidelines and they have implemented those. And what happens is, say we have a student who is a close contact, or maybe even in the building that's a test positive, and maybe they've been in school for the last 48 hours with their classmates, then what we do is we determine the point of contact, the date of contact. I will determine maybe the time that those students can come back to school. But then our administration, they do all the contact tracing and all the phone calls to the parents, have those students picked up. We house them in the sick clinic so that they're not, if they would have any kind of illnesses, they would not be exposed to well kids. So really, administratively, the principals have taken the big brunt of doing the contact tracing and the contacting of the parents to have them picked up.
So when you mention, those situations with people either testing positive or coming in close contact, how do you keep people calm in those situations? Because that can be a very, scary situation considering our current pandemic. People are very uneasy about this situation. How do you keep people calm and feeling protected in those situations where, you have to get in and get a student and exit them immediately?
I think the longer the pandemic has gone on, the more we've kind of got a sense of history with it. And we're realizing, I think initially we thought we had to have gowns and gloves and shoe covers and face guards and goggles and, all these things. And what we're finding that the mask is a huge barrier to infection, because we're at least keeping that airway not being exposed to virus. So just having that history and knowing that it's not as transmittable if you keep your distance and you're not having to do as many, it's not as scary as it was initially. So from that standpoint, the calm comes with history. I think following science has helped to realize that even when we came back to school, we are seeing that students are not transmitting this at school amongst in the school classroom environment. There's enough distance. They're facing forward. We're not, they're not mingling. We've done enough things that we're not seeing kids transmitting it. Now, parties outside of this environment, and where they're transmitting it more outside of the school setting, maybe a sporting event or things where they're less formal. But in the school setting, it's not been transmitted as much as we thought it was going to be.
So how can parents or people in the community outside of school, you mentioned that that's really where the main spread has come, how can they stay informed with the vaccines, making sure that they're eligible to come to school if they do come in close contact, and having medical records kind of with those situations? How can the people in the community work with that?
I think not being afraid to reach out and ask questions. It's been a learning curve for all of us, and the more you have to give information to someone, the more confident you feel in the information you're conveying. So I feel like that once I've had an opportunity to talk to a parent, and they say they're in the middle of, oh my gosh, we were at a party on Saturday night and somebody had COVID. Well, were you with them? Well, how close were you to that person? Well, I know they were there. And the panic kind of happens just because they happen to be in the same environment as somebody. So helping to talk them down. Let's look at the reasonable risk that you would have gotten from being in that environment. What would be reasonable for your level of exposure? Was it longer than 15 minutes? Did you say hi to them across the room? So just giving them some, look at your scenario, giving them some confidence in how calculated their risk was and how much exposure they would have had. What would be the real risk of them getting an illness from that? So just having them have a little control and realizing that wearing your mask and keeping distance is a lot of times enough to keep you from being infected in maybe an infectious environment.
Absolutely. So can you kind of explain your partnership that you have with the local universities and what students learn from you in person throughout this situation, with your local parents?
Okay. Greater Clark has a relationship with the Ivy Tech and with IUS, and I think it's just not with the nursing program. I think it involves their counseling program, probably their educational program, maybe some OT/PT. I'm not sure how in depth they've gotten with the relationship, but I do know that we'd have student teachers here. And when nurses are in clinical environment, they may be in their OB/Peds rotation. They may every person in the school setting is in peds. So it's a different kind of nursing program. So they will rotate through maybe Jeff High or maybe Parkwood or Parkview or some of those other where the nurses are. And they may rotate through those buildings just to get a feel for what school nursing is all about. It's dealing with pediatrics, it's dealing with community nursing. And community nursing is so much different than a clinical hospital nurse setting. So this is nursing, and people don't think about nursing being something in a school setting. Teachers are important in a school setting. Nurses are important in a hospital. But actually having a nurse in a school setting improves seat time. It improves attendance. It improves kids' ability to function. They know they've got resources available to them, and accommodating a student with issues and making those accommodations, they're going to learn better. So it's going to improve scores, it's going to improve attendance, it's going to improve a lot of things. So I think once a student nurse comes in and they realize that the vast amount of responsibility that we have to that whole student, they start realizing that school nurse is a specialty. You can be certified as a school nurse just the way you can be an oncology nurse or a ortho nurse or whatever. So you can get certification in ER nurse or critical care nurse. All those have certain critical criteria that you can get to be certified, and the same for school nursing. It's a specialty, and it's something a lot of people don't think about as being something they would want to pursue.
So when you talk about local universities and their pairings here at Jeff, and all across the schools throughout the Greater Clark community, What advice would you give students in the community that would like to become a nurse, a school nurse, any kind of nurse for that? That what are the benefits of being involved with the medical field?
Because the medical field involves the whole person, and if you are a people person at all, or if you love science and how cells work and how chemistry works within the body, I think that being a nurse, you get a taste of all of it. Nursing looks at the human element of medicine and how the individual has to cope with day-to-day activities and day-to-day life. And so a nurse is dealing with getting them to a higher functioning level. So I think when you come to, from a school nurse standpoint, you're in this specific setting. And so you can reach them at a mental health level, you can reach them at a physical level, from a medical level. You can reach them from a lot of different levels, students. And so, and Grant, being a teenager is not the easiest place to be emotionally. So many social, especially with social media and that kind of thing, it's very difficult to be a teenager anyway. And so having resources available to you, counselors and nursing and that type of thing available to you, I think was just going to make you have better outcomes as a student and as an adult long term.
So you talked about kind of the advantages of being involved with the medical field. What are some of the advantages and disadvantages of being a school nurse rather than any kind of nurse? Because there are many kinds of nurses all across the board.
Right.
We talked about that before we got started here. But what are some of the advantages and disadvantages to being a school nurse rather than any other kind of nurse in the medical field?
My experience is critical care. So I started out in critical care. I worked at Jewish for several years in their heart unit, that was telemetry units. And then I came from critical care to Jeff High, which makes no sense whatsoever. It's a big jump. It's a huge jump. It makes no sense. But what I find is that my experience from a critical care nurse standpoint gives me the tools. I think it makes me a better school nurse because I know the extreme that someone goes through that when they're critical. And so most of our students walking in the hallways are not critical, but you learn to look for what is not normal. And you look, when you meet a student who comes in and you notice, you know, a dark line on their neck or the gray around their lips, or you notice discoloration of their eyes, or you notice maybe some hair loss or whatever, because you have that level of experience, it allows you to look at that student from a little bit different standpoint. And I think it makes me a better school nurse. And you get some better catches. I mean, you can actually help to contact a parent and say, you know, I've noticed this. You might want to follow up with a provider and to try, maybe you can address some issues that the student didn't even know they had and then get them addressed maybe a little earlier. So, but the advantage to being a school nurse, so this is the basic advantage, would be that there's no nights or weekends. There's no holidays, you know, so when you work at, there's no Christmas, you know, there's Christmas breaks, there's spring breaks, there's fall breaks, there's summer breaks. The beginning of the school year is fast and furious, and it stays for weeks on end, whereas when you work in a hospital setting, you leave after your 8 or 12-hour shift is over, and you don't take that work home with you because somebody picks it up and you've passed the ball. Whereas when you're a school nurse, it's all yours, and you're responsible for those 2,000 plus students, and you want to make sure that you're accommodating those students the best you can and make sure that their needs are being met so they can be more successful in the classroom.
Absolutely. So you mentioned your pairing with your university pairings with local universities and stuff like that, but what are your pairings with the state and local health departments with the COVID vaccines and just everything going on right now? What are your pairings with them?
We have always worked really close with Clark County Health Department. Dr. Yazel is the medical director for the Clark County Health Department, and he has been real active in helping with Stop the Bleed programs and reaching out to police and educators and stuff. He has a real strong presence in the community. But with the COVID pandemic, he's reached out to us, and I actually work at least one day a week, 4 hours. I try to get at least one shift in where I'm actually giving vaccines, and so, and then we all on a mailing list that we get information about what's coming down from the state. So I can help to inform the teachers when it's time, when your age level is in. And we just got word today, actually, that all educators and teachers and staff are now eligible in the state of Indiana to get their vaccine. So I get to convey information. A lot of nursing is education. And so having a desire to be a teacher at one point in my life, this kind of matches both parts of my personality.
Meets it right in the middle.
Right. So I get get that science aspect. I get the little math aspect too, like documentation and keeping everything in line, but it also gives me that opportunity to do a lot of education. So it's a good mix.
So how do you stay engaged with students who are on e-learning? You know, we talked about that at the very beginning of the show here. How do you stay engaged with the kids that are on e-learning and not in the building on a day-to-day basis that need your attention? There's a lot of issues, not just with the pandemic. There's a lot of issues, you know, in the world right now that kids are dealing with. How do you stay involved with that?
And really, I don't think I do. I think that it's such a massive, it's almost like out of sight, out of mind, you know, but, you know, you have such a massive amount of things going on in the building that you kind of are focused on those items. And so those students that don't reach out to you and say, no, you know, that I've got an issue. And, you know, we have had issues at Jeff for years of people needing resources because of maybe new moms. We have, you know, or maybe just not even having food available or something. So connecting those people with resources in the community is a part of my job as well. And so, or finding the resources in the building even that you can send those students to. And I tell the nurses and the students that come to see me, you are only as good as the resources you have available to you. And if you don't know what resources that you have available to you are, then you're not even going to be as good of a nurse. So always utilizing those and pushing those people out. But I think it's almost like when you're outside the community, outside the school at this point, it's almost like they have to reach into us. And it's kind of sad that it's almost like a bit of a forgotten people from a nursing standpoint, from the school nursing standpoint.
Yeah, so how have you helped in creating guidelines and health standards for the school throughout the year?
A lot of those come down from administration. So policy is set based upon need, and then so the school board sets policy as far as how we administer medication, how we would deal with certain crises. You know, there's certain criteria, and even from Dr. Yazel, from the county perspective, we get criteria that he kind of gives us guidelines. But we have policies and protocols that come to us. So we basically, medication's a good example. We have to have a doctor's order. And 90% of my job is done from the perspective of a doctor's order. I can't diagnose, I can't treat without orders, but there are certain things that I can ease a lot of discomfort or ease issues by giving them education, by giving them resources, or by giving them a hope. Sometimes it's just a matter of that. But I don't get to set as much policy as far as what's done as a nurse. However, the rapport that I have with the administrators and with the teachers, I've been here for 15 years now, and so developing that relationship with the teachers, that mutual respect, having accountability for the students, knowing that when they leave their classroom that they should come to me. I'll let them know they came at this time, they left at this time, and all the documentation that goes on in the health office. Then I'm supporting the teacher, they're supporting us, we're supporting the student. And counselors. So I think that building the relationship with the team that supports the teachers, that's the part I think I get to influence. And just probably trying to be professional and smart with what, know what is really factual and not, giving your own opinion necessarily, but just helping people to follow the science.
So how would you advise parents to help their children with their mental health during this time? I mean, it is a big issue across the board everywhere.
It is.
But not just as a school nurse, but as a mother as well. How would you advise parents across the community to deal with that situation?
I think that most children will push as far as they can push, and they want to do whatever they think they can get by with. And if mom's not going to ask, then they're going to try it on dad, or they're going to try it on grandma. They're going to get what they were going to push to get what they want. So I think that setting real clear boundaries for students is, first of all, just for them to know how far they can push, to know where their boundaries are. That gives them a more sense of security. So I think setting boundaries would be number one. And that includes bedtime, that includes screen time, that includes accountability of, your parents should be able to see what you're doing. If you're having to hide, then that creates a lot of angst and anxiety that you're maybe gone beyond a safe zone for you. So creating that safe environment, not only in the home, but from the screen, and even knowing who their friends are, and protecting them even from, sometimes saying no is sometimes the best thing you can do for a child, to not.
Protecting them from those bad influences.
Right, because you may not know, they're not going to know, because of their friends. They don't know until you're older that you realize, oh, that could have been a pretty sketchy situation I was in, but you don't realize that at the time. So sometimes just being there more than they want you to be, maybe providing that safety helps with their mental health. A lot of anxiety, I call it the trifecta. I see right now 3 diagnoses that come through, and I see it more and more every year. I see ADHD, anxiety, and depression. And you'll see those 3 things in combination with diagnoses that come with students. And I think not having that safety and not knowing where the boundaries are, that creates that anxiety. It creates, not knowing, you can bounce easier. And then when the more anxiety you have, then it creates depression and those type of other mental health issues.
Yeah, so my final question here for you, what are your goals going forward into the next school year to provide a healthy environment for students here in the Greater Clark community?
This has been a really difficult year for maintaining standards as far as vaccines are concerned. There's been a lot of fear about going to see your provider. So hopefully, as this year starts to wind down, and we're in our last quarter, we only have, basically 9 more weeks after this week that we're going to be having kids in the building. But helping parents to realize that we have directives from the state. They've kind of been thrown out the window. They've been a little loose this year, just because of the fear factor. But now that we're getting it's not scary you should go see your provider. You maybe have put off exams longer than you should have. Get your children in and get them looked at and to check their vaccines. And it won't be too long. I don't think that before we'll have a vaccine for students that we can, even for the virus. So having adults getting vaccinated and realizing the comfort level that their life is going to experience once they're vaccinated, and not have all the constraints and the fear. The fear is huge for a lot of people, and especially if you've lost a family member. And we've lost a lot of people in this community from the virus, and a lot of people have lost grandparents and family members, and it's painful. So knowing that part is going to be gone, I think just encouraging parents to find, what do your students need? Reach out to me. Reach out to find out to your provider. And you don't have to take them to the doctor. You can take them to your pharmacy. You can take them to the health department. You can take them to, and if you don't have insurance, let's get that resolved. There's always some place that we can take your student to get them provided for from an immunization standpoint. And if they need health care and it's not available to you, or you don't think it's available to you, there's ways. If there's a will, there's a way. And I want to be a resource to those people to help them to get connected. And there's navigators in the community. Sometimes it's just not knowing where to turn. So that's part of the educational process. It's part of the assessment process of a nurse to look at what is it that individual, what is it that this group of people, what is it that school, our community, it just expands out and expands out. And I'm a part of that. I'm a cog of that. But the big picture is we're all in this together. So.
Absolutely. Well, thank you so much for taking time out of your very busy day to make time for us.
All right. Well, thank you. I really appreciate you coming and asking me to do this. It's good. It's rewarding. It's a rewarding position to have, and being a part of Jeff High. And I am proud to be the Jeff High nurse.
Absolutely, thank you. So
Thank
you heard
you.
it there. That was our most recent edition of School Talks here on our socially distanced WJHI production.